How important is it to be at an ideal weight prior to a facelift? Lost 20 pounds. Should I work on the additional 30 pounds first?
Thank you for your question. You submitted a single photo, a side view of your face, and you're asking about how important is being at a certain weight before a facelift. You state that you've lost 20 pounds and you are intending to lose another 30 pounds. Well, I can certainly give you some perspective on how I evaluate people who ask me exactly this question in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facial aging is a very significant part of my practice, and I perform all types of facelifting surgery, everything from minimally invasive suture suspension all the way to deep plane facelifting with facial implants, fat grafting, etc. So I have a lot of experience with facelifting, and I certainly can give you some guidance as to how I assess this type of question. So to begin with, understanding the two elements of facial aging that factor into how I evaluate a patient for facelift. One is volume loss. Volume loss with facial aging is particularly significant at the bone level, but also at the layer of fat under the skin. Now, beyond that, there's also degree of sagging. There's sagging in terms of sagging of skin under the neck, the sagging of skin at the jawline, the sagging of the cheek tissue. Now, that being said, it is generally well appreciated by people over 40 that when you lose weight, you want to lose weight in other parts of your body, like your stomach and your hips, but concurrently you tend to look like you lost a lot more weight proportionally in the face. And there is a significant element of that issue factored into facelifting surgery. So when I talk to patients about this particular, like someone like yourself who intends to lose about 30 pounds, I tell them if you are within 10 pounds of your target body weight, then usually that's a comfortable zone where I feel I can very accurately do what I need to do from a repositioning or lifting procedure. And very often I'll combine facelifting with volume corrective procedures, anything from injectable filler, fat grafting, facial implants. All of these things essentially are to balance out the two elements of facial aging. So I think that you can probably wait a little bit. And as someone who also performs body contouring, liposuction, both as well as non-surgical fat reduction with laser technology, we always understand that that in general, most people have maybe a target objective for weight loss, but very often they tend to plateau at a certain point. And so if that plateau is somewhere within the 10 pounds of your target weight, usually that is acceptable. In addition, you also want to think about how stable your weight will be. If there is any concern about the stability of that weight loss, then you may want to wait a few months to see if you're kind of holding steady at a certain level. So again, yes, to summarize, if you plan on losing 30 pounds more, chances are it will manifest in the facial volume, and that impacts the surgical approach of repositioning as well as the strategy of restoring volume, whether it's at the time of surgery or after surgery. So meet with qualified, experienced cosmetic surgeon who can guide you along the way. You may, if you have 30 pounds that you want to lose, and a typical safe estimate of weight loss is about a pound a week, you may want to also consider other procedures prior to that weight loss so you can at least look your best, or maybe even do things in preparation for the facelifting procedure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.